you work with children with speech sound disorders, today's episode is simply a can't miss. I'm going to encourage you to do something different. And that something different is to take those clusters and try them out at the ends of the words. Now, I've been using consonant clusters, if you know me, for the last 20 years or so, and they are very, very powerful. The research behind using complex consonant clusters, the body of work expands past the last 30 years, and multiple studies have shown that this is an evidence-based strategy, selecting complex clusters to maximize your gains in speech sound disorders. What my research has shown over the years is that the higher you aim, the higher you gain, period. If you want maximal, optimal gains in speech sound disorders, go for the most challenging clusters in our language, and that would be the three-element S-blends. So those are going to be the clusters that are going to maximize your gains, not only in the three-element S-blend those sounds in that blend that you are targeting, but all of the sounds that are underneath that sound. Just to give you a little bit of vocabulary, the three-element blend, S-blends, are known as the marked form. Marked in that they're the more complex form. So when you work on that marked form, the unmarked form, which is the less complex form, is going to naturally develop. For instance, if you're working on SKR blends, you're going to get SK for free. It doesn't work on the other way around. So if you're working on SK, you're not going to get SKR for free. So what you want to do is aim as high as you can. And when it comes to clusters, you want to go for the three-element clusters. It's like poker. Three of a kind beats two of a kind beats a single. You're going to want to go for those three-element clusters whenever possible. We did the research here. It's on ResearchGate if you want to check it out. It's in my book. I've written about it. We did it with large numbers of students in which we kept all things the same except for the cluster. The target matters not a little, but the target matters a lot. Research that I have not done and that has not been done in peer-reviewed research as of yet, except right here at my fingertips in this 2025 article that you are going to find in the links below. This is an exciting article. They looked at these complex clusters and they said, what happens if we use them at the ends of the words? So our target word, for instance, might be mix. So if you mix something, in that word mix, where the cluster is at the end of the word, are we going to have the same impact? Are we going to see gains on untreated sounds if we work at the clusters at the ends of the words? So it's really exciting research. And even looking at the cluster at the end of the word, or the cluster at the beginning of the word, which one is more complex? And it's not a black and white response when you look at that, because you can look at the clusters at the end of the words, and if they are morphological nature, if there's a morphological ending, that might be more complex. It's later developed. You have a plural at the end. You have other morphological markers at the end of that, making it later developing and more complex than the cluster at the beginning of the word. So it's not a simple apples to apples comparison. You might also have, when you're working at clusters at the end of the words, the rarer these words are. So they're less often said, so they're probably going to be more difficult to say, developing at a later age because it's a rare word. It's not a common word. So it's not as simple as saying the initial clusters are more complex than the final clusters, and you're not going to find any professional that's going to say the marked form or the more complex form is going to be the initial cluster instead of the final cluster. And if you work on the initial cluster, you're going to get the final cluster for free. No one's going to say that because there's so many other variables at play when it comes to whether initial or final cluster is more complex. So this research is pretty fascinating. And the reason it's fascinating is it's doing a gap that hasn't been done before. And that is looking at the efficacy of clusters at the end of words, and only looking at that, not working on the clusters at the end of words, simply manipulating the cluster at the end of the word. What we want to see is what happened. Was that effective working at final clusters in themselves? And I want to walk you through this study so that you're able to actually try this method on your back porch and see how this works with your students. So when we go into this study, this is only 8 children. Now, this is what speech sound disorder research looks like. It looks like a case study of, I have 10 fingers on my hand. It's usually less than 10 children that are studied in this research. There's usually no alternate control group that's involved. It's not random control, trial, double blind. That's not what we're talking about. We're talking about we had 8 children that received this intervention pre, post test. What happened? What were the gains for these 8 children? What makes this research cool is they actually tell us this is what we did. So you can try this and see if this works with your children. It's only a 6-week time period, and they made generalizable gains in a 6-week time period. So according to James Law Meta-Analytic Review in 1999, you could see that it took 6 to 8 weeks for what you're working on therapy in speech or in language to actually generalize, in which the child's actually producing that on a standardized test or in a probe. It takes time for generalization to occur. The fact that all 8 children between the ages of 3.5 to roughly 6.5, they all ate. They all made generalizable gains after only 18 sessions is very impressive. So that tells us this is something that is very promising, that for you to take this and try it in your practice. And of course, you're going to combine that in the evidence-based practice triangle. The evidence-based practice triangle is so important in speech sound disorder field because we have case studies. That's probably the weakest link of the triangle because you have 8 children we're talking about here. You also have what your knowledge of the individual child and what the individual child's needs are and what the evidence base is for that type of individual child. This is what works with children with apraxia. This is what works with children that have phonological processes. This is what works with children that have distortions of certain sounds. You have that research base there, that individual child piece. We know this is the child's temperament, other factors as well that'll impact how you're going to perform therapy. You put that into the mix. And then the other side of the triangle is your clinical expertise. I've been doing this for close to 25 years. I know this doesn't work, this does work, and I'm always working on cutting the fat. What is going to waste time? Take that out and do more of what makes the most out of the time. So this is what is cool about this study. What they want to do is use our time more efficiently. And I've tried this in the past, and I've been effective on improving language and speech at the same time by using a paragraph instead of a sentence or a phrase when we're doing speech sound disorder therapy. But what they're doing here is they're saying, can we improve grammatical morphemes? Can we improve the endings of words that children with speech language impairment, or whether you call it language delays, what they have difficulty with, by working on endings of the words while we're working on speech sound disorders? They're looking at how can we more efficiently use our time so that we get gains in speech and we get gains in language. Now, they did not study this, or this was not reported in this article, whether or not there was improvements in language. There is no spelt pre or post test to see if there was improvement in grammatical morphemes. We can't make that statement. And on top of that, when I look at the 8 children that they studied, they have normal language development. These children are all within 1 standard deviation of the mean when it comes to language. So these children have intact language skills that they studied in this approach. But I like the way that they're thinking. And what they're thinking is, how can we be more efficient with the very little time that we have? So when I look at a weakness of the study when it comes to your back porch, is they did 3 35 to 45-minute sessions a week. Now, I don't know anyone that's providing that much therapy in the real world. This is what the universities do. The universities are doing 4, 5 sessions a week, even 3 sessions a week. We know that more often produces more gains. Frequency really does make a difference. However, when it comes to our school setting, or if you're working in a clinic, oftentimes if you're in a clinic setting, the insurance will cover one session a week, 45 minutes. If you're working in a school session, 3 sessions a week for 45 minutes for speech sound disorders is simply, I think, totally unheard of, let alone for a child with severe impairment, 3 sessions a week of 45 minutes. And that's unfortunate that they used that time period that we can't replicate on our back porches. But what I do like about this research when we look at it is they tell us exactly what they did. And I'm going to tell you some things that they did that I found to be highly beneficial in my work on my back porch. They limited the number of examples. One thing they did is they picked verbs. Now, I don't know how they used these verbs because I use verbs because I'll say, okay, can you stretch it to me, please? Can you drop it to me, please? Something where it's like you're getting that piece and it's meaningful, it's in context. I like to use the verbs because then it's going to accelerate the gains. When I said drop it to me, I get something, the gains are going to happen more quickly. They're going to remember it. It's going to be less prone to regression. So one thing they did is they picked 6 verbs based on the final consonant that they're doing, the final cluster. And I'm going to give you an example of this so you can picture how to do this on your back porch in case you don't dive into the article. Of course, you're in ASHA, you get this article for free if you're a member of ASHA. Otherwise, you got to pay $30. Hopefully, this is going to be helpful. When I look at the table, for instance, they're looking at verbs. They tell you exactly what 6 verbs they used over those 18 sessions. Now, when I talk about that, using these same words over the 18 sessions, what is the benefit of that? The benefit of that is that then the children are not focusing on what they're saying, they're focusing on how they're saying it. They're focusing on keeping the teeth together for the S sound, like keeping the tongue back for the K sound. They're thinking about how they are speaking. You do not want to continue to change the exemplars. More exemplars means that you're going to have the child focusing on what they're saying instead of how they're saying it. And the research indicates that not only does this generalize to other words, it even generalizes cross-linguistically. So for instance, if you're working in English with a child, you're going to find that these sounds that they're showing improvement on, such as fronting, such as all of these other common errors that you're finding that they're having difficulties with, such as stopping, you're going to see that in Spanish. You never worked with a child in Spanish, you're going to see gains as well. So the research shows that you don't have to study every word under the sun in order to make the gains. You need to focus on the motor planning, the motor programming, the execution of the sound. And you want to stop having to talk and give that imitation prompt. Because when you give that imitation prompt, you are doing the motor planning, the motor programming, the execution for the child. The child is passively along for the ride. There's an external locus of control. You want to stop talking as soon as possible. How can you do that? Keep your exemplars, your targets the same. Then you're not going to be saying them every single day, and the child's simply parroting you. So that is one thing I love that they did. They kept it to 6, that they studied the same 6 verbs for each of the child. Let me give you an example. Mix, max, fix, wax, box. They're using these same verbs the whole time. There's definitely benefit to that. That's one thing they're doing. The first 8 sessions, they had the verbal model. Here they're establishing accurate production. Then what do they do in the second 8 sessions? They remove the verbal model. Very important. That's when the child becomes the teacher. That's when there's an internal locus of control. That's when the child is taking the driver's seat, doing the motor planning, doing the motor programming, and doing the execution. And you're the student. Very important pass of the baton. This, to me, is a effective speech sound disorder practice. I'm loving this. I don't know what the activities they were doing. They were doing it through telepractice, which is very interesting because we're looking at a 3.5-year-old through telepractice that's doing complex clusters at the ends of words, making generalizable gains after only 6 weeks. That's impressive. A lot of people are like, well, the complexity approach is good if the child is older, blah, 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 blah. That's not the case. The complexity approach, I've studied it across diverse students. The more complex the cluster, the better the gains. The research is showing that even with children with childhood apraxia of speech, more complex clusters, higher gains. That is how they did this. They looked at monomorphemic. That means one morpheme, okay? Monomorphemic. You got to make everything complex. For instance, the word mix, you don't have a morphological, grammatical morpheme added onto the end. They called those bimorphemic. Bimorphemic is when you added something to the end. For instance, a third person, like the eagle soars. You're doing that third person, adding that S onto the end, third person tense. That's when it's bimorphemic, meaning that you are going to have two morphemes combined. You have that grammatical ending. After 6 weeks, is that they found that the monomorphemic, where they didn't have the morphological ending at the end of the word, was a little bit more effective, though it's not definitive. They said that seemed to be a bit more effective. And that makes sense because what you find is if you have those morphological endings, is you are often going to have a past in which the children are misproducing those morphological endings, and they're doing it often. For instance, if you look at the REST approach from Patricia McCabe and out in Australia, she uses nonsense words. Why does she use nonsense words? Because she doesn't want to deal with the history that you have of inaccurate production. So for instance, there was a child I was seeing today, and the parent told me he cannot say this. We're working on S at the end of the words. He cannot say this for the life of him because he's been saying the word this since he's 1 over and over and over again to refer to things because people don't understand him. So he's always been saying this, this, this. I'm not going to say the real word. No one's going to understand me. And he deletes the final S. So she has tried everything under the sun, but it's because for 3 years he's been deleting that S. It's such a hard word. But other words that are novel words, so if we take a word such as mix, max, pax, these words that he's never said before, it's going to be so much easier because he hasn't been misproducing those for 3 years. I could see why, especially at the 6-week period, using the morphological endings is going to be tougher because they're used to misproducing those endings. And now you're going to have that be a treatment target in which there you have previous habituated errored behavior that you have to override. You're not going there with a blank slate when you're adding onto those morphological endings. And aside from that, morphological endings are more complex. So it's a more complex target. And so we're going to take everything, like you said, you take everything with a grain of salt. Does that mean that you should pick the ones without the morphological ending? That just tells us it's something to consider. Once again, you're not comparing apples to apples. If you're going to add those morphological endings, you're adding a language component, you're adding a background experience component to it. So it might be more challenging. However, you might get more bang for your buck. They didn't do a spelt test. They didn't do an assessment of grammatical morphemes pre and post to see if there's benefit in actually having those grammatical morphemes at the end of the words. There's so much to learn, so much to know. So these are things that I like that they did. They also had high density, on average, 100 per session. You have to be thinking they were saying these 6 words 300 times a week. That's really dense. And I don't know anyone that's able to do that on their back porch with the limitations in insurance funding and the limitations in high caseload numbers in a school setting. Now, as I've mentioned before, you need that high number of reps if you're working at a single word level. If you're working at a paragraph level, you do not need those high level of reps. But if you're working at the paragraph level, like I do in my SIS membership with my paragraphs, You are carrying a 100-pound dumbbell. That child is working so hard and they're growing in so many ways, and it's all going to improve the child's linguistic system. Okay. And when the child's linguistic system is improved, then the child's going to speak more clearly. So if you want to see this research, you can see it on ResearchGate. You can see it in the book. The children that I use the paragraph on, instead of a complex sentence, we're not even talking about a word, instead of a complex sentence, they had higher gains, not only in mean length of utterance, they also had higher gains in articulation. And I believe the reason for that is you're improving verbal working memory. So you're improving the ability for the child to hold multiple pieces of linguistic information and express it, because they're saying paragraphs instead of complex sentences. What does that mean? This child's going to find it easier to say 3-element clusters, 2-element clusters. This child's going to find it easier to say 4-syllable, 3-syllable, even 2-syllable words, because their verbal working memory has improved. And in doing so, that will improve not only the language, but also the speech. If you're only working at a single word level, you do have those 1-pound, 2-pound dumbbells. If you have those dumbbells, you can get there, but you've got to do hundreds of reps. It's the same thing with language. The research is panning out that if you're doing storytelling, that's the paragraph, right? The children are saying paragraphs. You're going to get better gains in language than if you're doing flashcards with hundreds of reps. Can you make gains with flashcards and hundreds of reps? You can, but you'll have to do hundreds of reps. It's the very same principle that applies in the body, applies in the mind or the mouth. If you're working out, you can get there with those 1-pound weights, but you gotta be prepared to do hundreds. You can also get there with a 100-pound dumbbell. Pick your pleasure. I prefer to use the paragraph because you're going to get gains across domains. It's better use of your very limited time. If you're working maybe in ABA and you're doing 40 hours a week, you can get the job done. You can do hundreds of reps. That's your way of getting there. It's not efficient use of time, but you've got the time. You can do that. I still think it wouldn't be good use of time because the child's neuroplasticity in the brain matters so much. Time is of the essence, and you would want to get gains at a faster rate, because with time you lose that neuroplasticity, and you want to create as much neuronal synapses as possible when there's plasticity in the brain. Going back to this research article, what this research article did find is exactly what we find in the clusters. When we work at the clusters in the initial position of words, what I've shown in all of my work is you have a cascading impact. So for instance, I might be working on my favorite blend of all, SKR blends. I'm going to say this, SCR blends. We'll say that because thinking about how we spell it, SCR blends. And with the SCR blends, what's going to happen? I'm going to get the P, B, T, D. I'm going to go up that ladder of how we innately develop speech. The simpler consonants will develop before the more complex ones. I'm going to get F, V, and then we're going to go up and up. S, Z, sh, ja, ch, ja. There's the affricates. There's the 2-element clusters. I might not get that 3-element cluster. I'm working with 3 and 4-year-olds here. They're not supposed to be able to do 3-element clusters. However, in speech therapy, I'm doing 3-element clusters with cues, and I'm doing that so the child's running up those steps. And the child's making gains really quickly, and it's very predictable. The only time it's not going to be predictable is if the child has autism, or if the child has a hearing impairment, or maybe if the child has a motor speech disorder. And there you're going to see differences because of neurological differences. You're not going to see that innate speech development that you're going to see with the other children, where I can close my eyes and I can turn the child's speech assessment over and I can tell you exactly what sounds they got and exactly what sounds they didn't get, because the earlier sounds develop before the later sounds. And I can also tell you that I didn't work on any of those sounds. I was working on the 3-element cluster and I got them all for free. That's exactly what they found in this 8-child study is they found, did the children get the complex clusters that they were working on? No, they got the sounds underneath those complex clusters. That is how the complexity approach works. This is promising. This is something that you're not off base if you take this 2025 research and you try it as part of your practice and see how the children respond in your practice today. We don't need to wait 17 years. That's the average amount of time it takes from something to be published in the research to be put into practice. You have the research here at your fingertips. This is one part of the triangle. You have the clinical expertise at your fingertips. You have the knowledge of your client at your fingertips. All we have to do is take it and try it out into practice. There's no reason to wait 17 years before you give this a try, because that's where we are right now, according to the research, in the implementation of the published research into practice. Let's just have it happen overnight. So that's what I'm going to encourage you to do. And I have a special treat for you, trick or treat. It's October, it's Halloween month. And the treat is for October, we always have a bonus in our SIS membership every single month. I thought, let's take this research and put this into practice and see how it works. And I made a little homework flip book. And the homework flip book is using one verb that's in the final position of words. And of course, I had to take that and I had to make it educationally rich because I don't do anything that's just going to work on one discrete skill. When I work on a skill, there's a lot of other skills that are happening within that skill. If you wanted to take that quick flip book and you want to download that and give that a try on your back porch, and go ahead and be one of those people that takes the research hot off the press and goes and puts it in practice next day and integrates it into your practice and do what works best on your back porch. What worked best, obviously, in the clinical setting is probably not going to work best in your back porch. I mean, I don't know anyone that's doing 3 45 hours a week in the real world. But what we see here is very promising after 6 weeks to see these gains. And the gains we're looking at for the most part in the study were medium effect size. When we look at a medium effect size, like what does that mean? It means basically if you look at a standard deviation, a medium effect size is approximately half a standard deviation improvement. When you see that much improvement in a 6-week period, that's worth looking into. That's promising. That's something that's like, maybe that's something I would like to integrate in my practice. I do see children that have special difficulty with word endings. And maybe taking those clusters and focusing on them at the end of the words would have benefit in their grammatical morphemes. Do we know that yet? No, that wasn't researched in here. Not only was that not researched in here, the children that studied this did not have language impairment. I am not saying do this with your children with language impairment. You're going to get improvements with grammatical morphemes. Nope. Nope. Not saying that. That hasn't been researched, and those kiddos haven't been researched. I'm saying maybe this is worth giving a try and seeing if it improves outcomes or not. We have that, and I encourage you to go ahead to the free download. You can join me in rolling up your sleeves and taking action. Do what you do best and roll up your sleeves and make the world a better place, one child at a time. With me, you're always going to be first.